And if you have veins, you really want to come in and get an evaluation to see if you're a candidate for this procedure or whether you need something more aggressive like that endovenous closure.
How long does this last, doctor?
It's so easy. This will not be uncomfortable at all, I promise you. I won't put you on the spot at all.
Way more,
It sounds like a lot, and it's really not. You'll see.
Okay.
Okay.
So 3, 2.
It's called therapy, right? Mm-hmm. Okay, great. We're on. We are going to be we're doing 3 demos today. We did my ears, we did Kylie's Botox, and now we're going to do Eileen's leg veins. And so we do quite a few leg veins here. I just want to mention Eileen owns the best hair salon in the desert. It's called Therapy, and it's on El Paseo. So if you need a new do, she's the woman to see. So we're going to be doing leg veins today, and we, at our office, we're going to be doing the spider veins. If you have anything bigger like varicose veins, then we're going to send you to a vein specialist that's going to do what we call endovenous closure. That's where they put lasers or radio frequency inside the big veins. We heat them up and then they die. But we work on these fine little things called telangiectasias. They're small, and my favorite thing to use for them is going to be glycerin. Now, glycerin is basically just high concentration sugar. And so you're going to see how easy this is. Now, Eileen, I forgot, did we wipe off your legs yet?
No.
Okay. Okay, so first thing we do is we just clean off the area with alcohol. And then do you have any on the inside of your knee? Just a little bit. Okay. Now, leg veins are super annoying. I've actually been on a leg vein journey myself. I had big varicose veins. In fact, my doctor said I had some of the worst that she's ever seen, which I thought seemed like an exaggeration to me because they didn't look that big. I don't know. I think she was trying to get me to be a repeat customer, actually. I don't know. Okay, so here we go. We're gonna get started. Now with this, we use a fine needle, and I like to bend the needle so that we can get it inside the vein easily. And then we just try to go just underneath the surface of the skin, and you can see that vein disappeared. Can you guys see that on camera?
Oh, yeah.
Okay, so now we're gonna go and we're gonna do this vein here. You just have to get in it. And see it flashes out some of the other veins. So we're going to do this one here. You see they immediately go away, and it causes a white blanching effect. Now, this product works as an irritant, so it irritates the inside of the blood vessel wall. And so what that means is it'll irritate the vessel wall, and then it's going to thrombose or cause a clot to form. And you can see that whole vein just disappeared all the way down.
We're getting a lot of wows in the comments.
Okay, great. And so we'll do this one here. How are you doing back there, Bill? And you can see.
How does she get treated, doctor?
With this, you're going to get treated once a month until they're gone. We typically recommend a series of like 5 treatments in order to get rid of these.
Does it hurt?
Eileen, does it hurt?
No, not really.
Just a little pinch, right?
Little pinches.
Mm-hmm. Not bad. Now, some of the older sclerosing agents that we use, like hypertonic saline, which is high concentrated salt solution, that would burn. One of the reasons I like this one is it has a very low risk of causing an ulceration. Do you see how they just disappeared? Are you catching that, Bill? Mm-hmm. Okay. And if you have veins, you really want to come in and get an evaluation to see if you're a candidate for this procedure or whether you need something more aggressive like that endovenous closure.
How long does this last, doctor?
You know, with veins, it lasts forever. Once you kill these, they should go away. But if you're genetically predisposed to getting them, you are going to get more. So for most of my patients, they come in every 6 months to a year to get touch-ups. And you can see it's just, I love this procedure because it's just sort of a little, very precise procedure that you do. And it's very rewarding when you see all the veins flash after you get the solution into the vein. Could I get another needle, please?
Abby says, yeah, I can't believe that. It literally vanished.
Mm-hmm. Okay, let's see, where else do we have? Oh, we have some good ones over here. There's some really good ones on this side. And can I get the sharps container, please? How are you doing, Eileen?
Good.
Good. And with this, there's really not a lot to it. We do a little compression on you, but you only have to keep it on for a couple hours, and you can go back to work. I don't want you doing any vigorous exercise for the next 24 hours, but that's it. And this will be a good one right here.
Is laser more effective than injections, doctor?
Lasers really aren't very effective for doing the superficial veins. And the reason for that is they can be on the surface or they can dive deep and they may come up. The laser will only target veins that are near the surface of the skin. But with the fluid, what will happen is the fluid will go down and it'll track down and follow the path of the vein. And so you can get rid of it, whereas the laser just won't work that well. When I first started with lasers, I tried every laser that we had to try to get rid of veins, and I wasn't successful with any of them. And I tried big veins, I tried small veins, I tried different wavelengths to see if I could get anything to work, and I just have not had any success. If anybody has a different opinion, I'd love to know what they used, and because we collect lasers here at Contour, and so if there's one that would work for veins, I'd love to know and get it. And you can see that just blanches. It's really nice. It's beautiful.
I definitely need this for sometimes they hurt. I'm sure I can't afford this.
I don't think it's very expensive, honestly. Do you know how much it is, Kylie?
Honestly, it's $275 a treatment.
Yeah, I think it's somewhere around $275 a treatment. You multiply that by 5, and that's about how much it would take to get rid of that. So I think we covered a lot of areas there. So Eileen will have back in a month, and we'll do a little bit more. Now, how was the pain?
It's not really painful, just a little pinching.
Little pinches? Yeah, so not bad at all. So that's sclerotherapy. It's another little thing that we can do to make ourselves look better. And I think it's funny because everything we do, I've actually had done. It's kind of sad, actually. So thank you for tuning in. Thank you for supporting our channel on YouTube, Instagram, Facebook, and TikTok.